Hello, and thank you for being with us here in Vienna for the Neurotrauma Treatment Simulation Center. I would like to ask you a few questions, so if we can start by telling us a few words about yourself, your background, focus, and in your practice.
Okay, so I am Dr. Johannes Robles. I'm by practice an internal medicine specialist as well as an adult neurologist and a critical care specialist, which means that I focus on a lot of patients in neurology as well as in the critical care units. So that's basically my focus. I deal with a lot of septic patients and brain trauma patients and stroke patients, depending on who comes into the unit. I am currently the head of the critical care services in my hospital, which is about a 200-bed unit with a 25-bed capacity ICU that's mixed. So we take in medical patients, surgical patients, and neurocritical care patients.
What motivated you to get involved in the neurotrauma research?
Okay, neurotrauma is a difficult aspect of neurology because there's very little information out there about how we can see all these patients, and the management is quite diverse. And I think that if we focus a little bit more on seeing these patients and taking a look at the characteristics and the outcomes of these patients, then we can actually improve outcomes for patients with neurological consequences or complications coming from brain trauma.
Compared to other domains of neuroscience like behavior science, vascular disease, what do you think that upholds greater interest in the domain of neurotrauma?
I think it's the opportunity for research, like we said, and I think that it's quite important to focus on all the other aspects or complications of neurotrauma, like psychological, cognitive impairment that happens after trauma. All these patients get overlooked because a lot of the focus is on the neurodegenerative or in the stroke. And brain trauma patients get very little attention because after they're injured and they get sent home, rehabilitation and cognitive interventions are rarely focused on.
Could you highlight the main challenges in the treatment of neurotrauma in your country, and if it's more specific possible to compare about your institution?
The Philippines is a very large archipelago, multiple islands, all interspersed, and there's a difficulty with how we can actually transport patients to big hospitals that actually can handle all these neurologically injured patients. So I think that the difficulty or the challenges there is actually being able to provide a hub for high-level care for trauma patients, because if they get admitted into small primary hospitals or secondary hospitals, then outcomes, mortalities are higher, and they're not given an opportunity for recovery. So I think that if the interventions or the approach to caring for these patients comes from the bigger aspect of the health service, then we can actually address more of the problems of these patients.
What is your opinion about an international TBI registry that have been spoken about these days here?
I think that is going to be a really good endeavor, something that can encourage people to take a look more about the kinds of patients that we have with neurotrauma, and to be able to cohesively decide on guidelines that can address these problems.
What are, in your opinion, the most important quality indicators in neurotrauma care?
I think it's quality of life and also cognitive impairment and rehabilitation. The post-ICU care is the one that really gets forgotten the most. We're very focused on managing these patients when they're inside the ICU, but when they get transferred out, there's very little care that continues to bringing them back to the way they were before in terms of work and cognitive ability, and I think that is one aspect that might need focus.
Everyone agreed here that the multidisciplinary team is a vital asset in TBI management. From your point of view, what specialists should be included in such a team for TBI?
Okay, I think that of course, a neurologist, a neurosurgeon, um, you have the psychiatrist or the psychologist, because we do know that there's a lot of cognitive problems that happen or ensue, even behavioral problems that come into play in terms of caring for these patients. Nutrition, physical therapy, occupational therapy, or basically all the rehabilitation sciences, so that also includes speech therapy. And I think that in terms of taking a look at those primary focus, I think that that would be sufficient if you want to make a cohesive team. But of course, you also need your nurses, you need your paramedical team, and of course, the patient and the family should be part of the multidisciplinary team.
Yeah. Something interesting. From your point of view, which are the main obstacles in terms of collaboration in such a multidisciplinary team?
The number of specialists that you have in a hospital. Like I said, if a hospital is not big enough, then you don't have those particular specialists in your hospital. So it becomes difficult because you have to reach out to these people or to these specialists outside of the hospital, and recovery or interventions get delayed because it gets put off until the patient gets discharged. And because healthcare is not provided by the government, it's actually out of pocket for most patients. The tendency there is for families and for patients to actually just decide, oh, we can take care of this patient at home. So I think that that is a main challenge in that particular realm of caring for neurotrauma patients.
How do you feel about an online community for those who are interested in neurotrauma? Do you think it would be helpful for medical practice and research as well?
Yes, because part of collaboration or multidisciplinary team management is seeing how people do it outside of where we work. If we just focus on how we do it, then that doesn't necessarily mean that we're doing it the right way. Collaborating with teams that are far more advanced or that have had more experience can actually help move hospitals in less advanced countries to improve their knowledge and their skills.
Which do you consider to be the main challenges in preventing neurotrauma?
Education. In my country, a lot of the people who ride motorcycles, which is one of the highest sources or where most of the neurotrauma patients come from, do not wear helmets, even if it's in the law. So I think that if we actually educate patients on how they can acquire brain trauma just from, or prevent brain trauma just from the mere putting on of a helmet or putting on ski pads or shin pads, or checking the brakes, or making sure that they have a driver's license or the permit to ride a motorcycle, then I think that people would be more careful and will be able to prevent trauma. And also, I think for elderly patients, maybe having the education on how they can address the inconvenience in the home for elderly patients can prevent falls, which is also another source of brain trauma patients.
We are almost done, but we cannot end without asking your opinion about the impact of COVID-19 over the management of neurotrauma in your country.
I think that one of the main problems there was actually access to care. People were afraid to leave their house, so even if they fell, hit their head, as long as they were still awake, they would wait until symptoms are far worse so that they can come to the hospital. And when they do come to the hospital, there are too many restrictions. So interventions that probably took 15-20 minutes before the COVID pandemic now take about an hour, and that significant delay in intervention already covers the golden hour for treating a patient with brain trauma or any kind of neurological injury. So I think that that is a very significant impact in terms of improving the outcomes of these patients, because there's constantly a delay in managing, and if surgery needs to happen, they have to wait for the RT-PCR, so a lot of things get delayed. So I think that that is where the pandemic has significantly impacted the care for brain trauma patients in my country.
Of course. Thank you very much. Thank you for being with us and for your time, and we hope to see you in our future events online with AMN or on site.
Okay. Thank you very much.